Hello viewers, today's lesson is on behavioral disorders or behavioral problems in children. The main objective of this lesson is to impart knowledge on the basic issues concerning behavior disorders in children, which includes the definition of the concept, the prevalence, causes, symptoms of the behavior disordered child. The second objective is to impart adequate knowledge for early identification for planning remedial therapies for children with behavioral disorders. Nobody is perfect. All the children have bouts of bad behavior. They may throw temper tantrums, talk back to their teachers or parents. But when things start getting out of the hand, it may be a clue that something in the child's or the teen life needs attention. The children or teens can be irritable and even hostile sometimes when they are not feeling well or when they are tired. They may argue with the parents and they disobey them. Young children also lie sometimes because they are too young to understand the difference between the truth and lie. Sometimes they lie to get out of the trouble. This is very normal with all the children. But when they act like this all the time and when this behavior is getting them into trouble at the home or at the school or with the neighboring kids in the colony, then they may have what we call the behavioral problem. Now we will try to have a clear understanding of what can be called a behavioral problem. Children regarded as having behavioral problem form a very broad group. Parents who experience difficulty managing their child may describe their child as having behavioral problem. It can be the expectations of the parents or their way of managing the child that are inappropriate rather than with the child's behavior. Problem behaviors are very common in the children. They are often trivial and are of short duration. More serious persistent problem is likely come to the attention of professionals. The professionals includes the health visitors, the school doctors, the teachers, nurses, a child psychologist or a child pediatrician or psychiatrist. Oppositional defiant disorder and conduct disorder are medically recognized categories of behavioral disorders in children. Children with behavioral disorders are not rare. Almost every one of us would have come across such a child at some time or the other. These are the youngsters who are in conflict with themselves or with those around them. They fail to establish close and satisfying ties with the other people. Some youngsters are withdrawn and the greater majority strike out with hostility and aggression. Although there is no universally accepted definition of behavioral disorders, most of the definitions have some common elements. Children with behavioral disorders exhibit behavior which is chronic, violates cultural and social norms, and affects the child's self-esteem, interpersonal relationships, and probably the school achievement. This is how we can explain a behavioral disorder in the child. Now we will see how prevalence is a behavioral disorder in children. The estimates of the prevalence of behavioral disorders vary tremendously. This is because of lack of clear-cut and precise definition of what can be considered as a problem behavior. The best available research data indicates that 2 to 10% of school-age children exhibit serious and persistent behavioral problems. The greatest proportion of behaviorally disordered population falls in mild to moderate range. Boys outnumber girls in every classification, and it is usually seen that the first-born males are more prone to this disturbed behavior. In schools, the prevalence is more during the early stages of their life and reaches peak in the middle grades, and slowly it wards off or decreases during the secondary years. After understanding what can be called a problem behavior and knowing the prevalence rate, now let's move to the classification of behavioral disorder. All young children can be naughty and defiant and impulsive from time to time. This is perfectly normal. However, some children have extremely difficult, challenging behavior that can be considered not normal outside the age. Kay and his colleagues classified the behavioral disorder into 5 dimensions or clusters. They are conduct disorders, oppositional defiant disorder, aggression, socialized aggression, anxiety and withdrawal. First one, the conduct disorder. The conduct disordered children are very hyperly aggressive and highly disruptive, constituting a major portion of school-aged behaviorally disordered pupil. Conduct disordered children display antisocial behavior, which behavior is disruptive, distressing and it is not age appropriate. Oppositional defiant disorder or the condition in which the child argues repeatedly with the authority figures and show resentment. They often throw temper tantrums, although physical aggression is limited in this type of disorder. Aggression is mostly concerned to teachers than any other behavioral disorder. Aggressive behavior is learned in many ways by observing the parents, siblings, friends, and most commonly this behavior is acquired through the characters which the child sees on the television and in movies. Socialized aggression. The children and youth in this category are hostile, disobedient, destructive and often display both physical and verbal aggression. The last type of disorder is anxiety and withdrawal. Anxious and withdrawn children internalize their behavior. They may display nausea, pains, headaches, fear, shyness, obsession, nightmares, crying and self-consciousness. Some children also suffer from phobias. Phobia, it means unrealistic fear, intense fear without any rational basis. Most of the children have the school phobia, which is accompanied by physical illness associated with tension and extreme emotion. These are the different types of behavioral disorders which we can find in children. All the children have moments when they do not behave properly. They go through different phases as they develop and become more independent. Toddlers and adolescents have this challenging moment while they push their limits. With the help of parents, caregivers and teachers, most of them will learn to behave appropriately. Occasionally, a child will throw temper tantrums or outburst aggressively or may demonstrate destructive behavior, but this is often nothing to worry. Causes of behavioral disorder: family related causes, cultural related causes and school related causes. We first look into the family related causes. A children's behavior problem arises from a condition affecting the child itself or the environment in which it grows, or sometimes these both. The family factors include the neglect, inconsistent parenting, unstable families, violence and antisocial personality in the parents or in the family. It is very difficult to establish the precise cause in any particular case of the behavioral disorder. Now, we will have a look into the cultural factors affecting the behavior. Parents and teachers tend to hold values and set behavioral standards, expectation which is consistent with the cultures in which they live and work. The children's attitude and behavior lean towards these cultural norms of their family, peers and communities. Some of the factors related to the culture are as follows: First one will be the mass media. Television shows, video shows, movies, magazines glamorize the behavior. The value of conspicuous models that are incompatible with the standards of many families. The community. Religious groups may preach certain behavior that is normal to the larger community. For example, dancing and dating. The children and young people who conform to these religious norms will be rejected by their peers, stigmatized and socially isolated. But while those who violate the religious teaching may feel extreme guilt. Intermarriages. Children of interracial marriages have difficulty developing a sense of identity, especially during the adolescence. They have major problem reconciling their mixed blood into a single and personal identity that affirms positive aspects of each heritage, while acknowledging the society's ambivalence towards the biracial persons. Now, we will look into the school related factors. The school plays the most important role and has a socializing influence on the behavior of the young children. There are 6 ways in which the school can contribute to the development of behavior disorder and academic failure in the child. They are insensitivity to the student's individuality, inappropriate student expectations, inconsistent management of behavior, instruction which is non-functional and irrelevant skills, destructive contingencies of reinforcement, and the mostly undesirable models of school conduct. These are all the causes leading to behavioral disorders in the young child. After having known about the causes, the classification of behavioral disorders, now we will move to the developmental consequence of behavioral disorders. What are the results of having a bad behavior or behavioral problems? What can be the results of it? Cognitive development. Many students with behavioral disorders may be slightly below the norm in cognitive development. Academic achievement. The children with behavioral disorders do not achieve well academically. They usually lag behind in their studies, especially in reading, math and spelling. The behavior often hinders efficient learning and conduct disorder in the child. Communication. Communication problems such as speech and language disorders are often found as co-occurring disabilities in children with behavioral disorder. Socio-emotional development. Many children with behavioral disorders do not have social competencies and they lack the social skills. They may show deficit in social cognition. Social cognition means the knowledge and cognitive activities used by the people in dealing with their social world. Co-occurring disabilities. Together with the speech and language disorders, the children with behavioral disorders may have learning disabilities. They have anxiety, mood swings, and Tourette's syndrome. Family variables. Raising a child with behavior disorder brings a great stress to the families. And the last one is the cultural and linguistic differences. Behavior which is considered normal and adaptive in a subculture may be looked as a deviant or inadequate by members of another community or group. Misdiagnosis is often a culprit. Equal importance are the ideologies and expectations of the school system which can have an immediate profound effect on the behavior. These are some of the consequences of having a behavior disorder or behavioral problem in children. Now, we will move to the preventive strategies, how the behavior problems can be prevented in children. The preventive strategies can be organized in three ways: the primary prevention, the secondary prevention, and the tertiary prevention. Primary prevention. It is most ethical and cost-effective approach. It includes reinforcement. Within behavioral approaches, rewards or reinforcers are used to increase the desirable behavior, and aversion technique to decrease or extinguish a undesirable behavior. Secondary prevention. Secondary level intervention focuses when the students are not responding to the primary prevention and they are at risk for adverse outcomes. Tertiary prevention. It includes plans to address the needs of the students with chronic challenging behaviors. Now we will see how the assessment of the children with behavior disorders can be done. The most popular method for assessing today is the Functional Behavioral Assessment (FBA). It seeks to determine the reason of the behavior and then it sets up the positive interventional programs. Now we will see how an intervener will work with the problematic behavior child. First, the intervener will specify the behavior of greatest concern. Then he will collect the archival data. The data can be from the teacher observation, the teacher rating scale, and the children's rating themselves. Then after observation becomes the cornerstone of any functional behavior. The observer records the instance of specific behavior to establish the frequency, durability, and age appropriateness of a behavior. The data recording can be simply as narrative system, or it may be more sophisticated with the codes to score the behavioral deviation, the language skills, and motor behavior. This is the way to assess a behavioral problem in the child. The common bad behavior or behavioral problems in the children are as follows. Stealing. This is a very bad behavior. It includes stealing money, the school property, or stealing fellow students' belongings. Truancy. This includes staying away from the school for no justifiable reason. The child simply loiters or wanders without going to the school. This leads to loss of valuable study time and may ultimately lead to the failure. Disobedience and insubordination. This can be disobedience, rebelliousness, and sarcasm, etc., to the teachers or school authorities. This bad behavior is commonly found in urban schools. This also leads to dismissal from school. Lying. Lies are told to the classroom teachers, to the head teachers, and prefects. Sometimes the parents also report about the cases of lying. A rude teacher who gives unfair punishment is likely lied to. And the next common behavioral pattern in the child is fighting. We can find this behavior very common in many schools. The fighting can be over food, over friends, or over properties which belongs to the students. Cheating. Young people find cheating an easy way to get through the examination. They may cheat at the exams, tests, and in many other school activities. Destructiveness. This includes destruction of school property during the strikes, unrest, or even on ordinary days in school. The children's dissatisfaction with the school's rules and welfare causes the strikes. So, these are some of the behavioral patterns which we find in behaviorally disordered children. After knowing the common behavioral patterns. Now we move to the common behavioral disorders. Disruptive behavior disorder. It is frequently found in the behavioral disordered child. It includes attention deficit hyperactivity disorder, oppositional defiant disorder, attention deficit hyperactivity disorder ADHD. It is characterized by short attention span, impulsiveness and overactivity. These children are easily distracted and have difficulty organizing work or cooperating in activities. Oppositional defiant disorder. It causes children to be argumentative with adults and frequently they lose their temper. The next type of disorder is conduct disorder. It is characterized by repetitive persistent pattern of behavior that violates the rights of others or rules appropriate for the child's age. The behavior is much more serious than playing ordinary pranks or mischiefs. Affective disorder. Of all the disorders, this is most commonly found. It is again of two types, depression and bipolar. The depression symptoms include feeling of sadness, hopelessness and irritability. Changes in eating. There is a significant weight gain or weight loss. Bipolar disorder. It is also known as manic depression. The symptoms include boundless energy and need for activity, decreased need to sleep or rest, and poor judgment. The next disorder is anxiety disorder. Anxiety disorder, it causes excessive unrealistic worries about the future events and excessive need for reassurance, preoccupation with appropriateness of past behavior. Obsessive compulsion disorder OCD. This produces a long bouts of repetitive thoughts. They are usually of unpleasant nature. They are followed by ritual actions to relieve the anxiety. The most common example that can be given here is a child may fear germs. It is an obsession and he has to wash his hands very frequently. That is a compulsion. Pervasive development disorder PDD. It occurs when the child's brain cannot process the information properly, resulting in thought distortions and developmental delays. This category includes autism spectrum disorder, Rett's syndrome and Asperger syndrome. And another type of behavioral disorder is schizophrenia. It is very serious and disabling mental illness. Most often, its symptoms first appear as a child reaches the late teens or early 20s. The symptoms of schizophrenia are poor reasoning, memory and judgment, loss of motivation and very poor concentration. These are some of the different types of behavioral disorders which can be found in problematic behavior child. Now let us move to early identification and planning interventional strategies for problematic behavior child or behavior disordered children. Early diagnosis of conduct disorder and other related difficulties is important to give a child a better chances for improvement. Depending on the severity of the problem, the treatment can be offered different settings. For example, like in a home, in community or in educational settings. The help offered will depend on the child's development, age and circumstances, involving and supporting their family. Focus should be on the strength and identifying the specific problem areas of the young persons. Strategies to modify the behavior. These are the following techniques which can help to modify the destructive behavior of the child. They are positive reinforcement. This is applied where there is a need to promote desirable behavior. You want to encourage a student to keep tidy books? Then observe the target behavior and reward it with a prize or a praise. Extension or ignore technique. This can be applied if you want a student behavior to become extinct. The best way to eliminate is just ignore the behavior rather than punishing it or reinforcing it. Systematic desensitization technique. This technique is effective when dealing with anxiety and other fear related problems. For example, if a student fears to talk in the class, in first step the child should be allowed to speak only with the teacher. When she is comfortable with it, let her speak with the teacher along with 1 or 2 classmates. Then she should be asked to participate in small group discussion. Thus, step by step the fear gets eliminated. The next and frequently used technique is the time out technique. It is used to control the occurrence of undesirable behavior, especially in pupils to withdraw privileges in the event of occurrence of undesirable behavior. The technique of negative reinforcement. Negative reinforcement is used to encourage the occurrence of desirable behavior by removing the obstacles against the reoccurrence. The next technique is the shaping technique. Shaping develops a desirable complex human behavior. This can be related to the example of systematic desensitization. Small successful steps can be linked together to produce the desirable behavior in the child. The last technique is assertive training. Assertive training is used to help pupil control excessive shyness and other fear related problems that impede their ability to live fully. These are some of the different ways of helping a child to eliminate undesirable behavior and have a behavior that is acceptable socially and by the parents in the school and in the community. Some of the most difficult challenges for the parent is their child's behavior. Unlike an injury or disease, the cure is not easily available for a problematic behavior child. The added fact is that as the child grows, his or her personality is also developing constantly and it is changing. The rules need to be changed according to the age of the child. So, the parents should take care while putting up the rules and conditions according to the age of the child. So, we have understood what is a problem behavior or behavioral disorder. We understood what can be the different types of behavior, and we understood what are the common behavioral patterns in children. We also understood what are the results of having this bad behavior, and we understood the different ways and techniques to help these children with behavioral disorders. I hope you have understood this lesson on behavioral disorder in the children clearly, and you can help the children with behavioral problems. Thank you.